coordinating data across sites is definitely a challenge, and one of the things that makes that work better is communication. In the work that we've done, when we work together collectively, when we are strategizing in ways that meet the context that we're working in, we have far better uptake in the research that we're using. So when we want to get research into practice, we make sure that we have inclusiveness, that all persons are participating, their voices are heard, and our strategies work far more effectively when we look at it that way.
From my own experience, I had to be very clear about what my minimum data set was, what it looked like, and even socialising that with the key stakeholders, with those at the sites, those people that are actually collecting the data, collecting the information. And the other top tip is really familiarise yourself with the current data systems, because that will actually help you shape your minimum data set and also how you're going to collect the information, because you could extrapolate some of the existing data that's there to answer the research question, because we are data rich and information poor at times. Maybe some of the information that you require isn't collected automatically. How can you ensure that the information that you require is part of everyday practice, and that you can flex and tailor the information you require out of what's currently happening? Familiarise yourself with the ICT team within the sites. I did that. Become very familiar with how they work, what systems they have, what pathways they have. And in terms of getting research into practice, it is important that you present your research in real world clinical situations, and also become familiar with what are your national clinical programs, what are the programs within your organisation at the moment from a clinical perspective, who are the clinical leads, who are the operational leads within your organisation, do you have a programme management office? And also being able to disseminate and share your work on platforms such as JBI, Evidence Implementation. It's a fantastic platform that has far reach and access and sharing of information, and you can actually utilise that to engage with other researchers and other people with same interests. So they from that perspective, they would be my top tips.
So the challenges with data collection across sites, and in our case across wards, it's been quite time consuming and often difficult to allocate to a single profession or discipline or person, and COVID has really impacted this for us. The importance of a highly motivated group that are involved in implementation has been highlighted. It's also been challenging to adapt to the process to each context, and we facilitated this by using clear implementation plans, supporting the implementation process at specific points, completing audits and providing feedback, as well as then providing forums for specific feedback, including workshops and online forms. And we tried to be as agile as we can around change as needed by the clinical teams based on their feedback. We have a dedicated team of clinicians that have been involved in data analysis or data collection and analysis, and we've invested in their development as clinician researchers, providing training and education for these people.
Thoughts on coordinated data collection. It all depends on how you use it. Personally, I think it is quite healthy. Standardization, simplicity will eliminate clusters of materials, reduce wasteful processes and defects on the collection methods. On the other hand, limitation might constrain the effectiveness and eventually impact the result. So what do? Well, you have to listen to what the data is telling you. Also, you have to listen to what your stakeholders are asking you. And of course, pay attention to the frontline staff. You do this, all will be golden.